Lipedema in arms is talked about less, but can still have some negative impacts on your life that are not just about how they look. So if you're not sure what lipedema is, it's something that predominantly affects women, and it's a condition that produces disease fat, which doesn't respond to diet or exercise. I have advanced lipedema in my legs, which severely affected my mobility before I started taking the GLP-1, which helps with that. I also have advanced lipedema in my arms, which impact on my life. They are not nice to look at, but it's more than that. So one of the huge challenges I have is that taking blood pressure is excruciatingly painful. So I can manage it once, but after that it becomes really painful and really difficult. And what that means is when they're taking blood pressure, because I'm in pain, it might not always be accurate. There have even been times in my life when I've been in hospital and I've had to negotiate with the doctor how many times they take my blood pressure because it's so painful. And the more they take it, the more pain that I'm in, the more sky-high readings they're going to get. And there's even been points where they've called an emergency doctor in the middle of the night until I've had to explain, no, it's because I'm in so much pain. I'm not going to die from a stroke any minute now. My blood pressure is probably fine. I'm just in a lot of pain. There's also been experiences where even the bariatric cuff hasn't fitted, so they've had to do it from a lower arm. And that also doesn't necessarily give accurate readings. So these are some of the things that are really important to think about. So when you see lipedema in arms, yes, it can be unsightly, and yes, people can get liposuction to make it look prettier, but actually it's more than that. There are actually medical reasons why we should still consider and take lipedema in our arms really seriously. And for me, eventually, if I can get surgery, I hope to do that, and I hope to tackle my arms, because I would actually like, for the first time in my life, to get accurate blood pressure readings that are not painful.